Yeah, you
Yeah,
can
so
go
I'm
first,
Michelle. I'm
please.
a senior physio for T Squared. 9 years clinical experience, and I work with like geriatric, previously neurological conditions, stroke, Parkinson, but also work with athletes and also like normal day population, general population. Yeah.
My name is Dimitar, originally from Macedonia. I started working out with athletes 2015, but personal training to 2011. For the past, I would say 14 years, we've experienced tons of different athletes and general population, and we help many people to move better, run faster, jump higher, and etc. Yep.
Yeah. So many of you know that being mobile is like key, but actually what is mobility? We're just going to break down a few components for you to understand. So mobility is basically the ability of your joint to move through full range of motion, and flexibility basically means the ability of muscle to lengthen and stretch through its range of motion. So stability and control. So we need stability in our joints to perform dynamic movements. So stability is basically the ability for you to control and maintain control of your joints during movement. So it's very important for like dynamic movements like running, your sports like tennis, golf, basketball. Okay, so the importance of joint by joint function, which means that specific joints are designed to basically improve, designed for like mobility and also stability.
Yes.
So some joints,
Yes.
yeah. So
Yes.
for your mobility joints would be.
So mobility, this is very important to understand because we have a lot of compensation between these joints. So basically, ankle joint, it's designed to be mobile. Then knee joint to stabilize. Then hip again mobile. So it goes one mobile, one stabilizer, one mobile, one stabilizer,
Yeah.
right? So it's very important because most of the people who are not physically ready, also athletes as well. So basically, if you don't have enough mobility in your ankle, it will cause instability in your knee. So that's how injury happens. Let's say ACL, meniscus, then lower back issues. So it's very important to perform an exercise that will help our joints to become mobile, and those who are needs to be stabilized, then to take the load of the physical activity.
Yes, correct. So for example, so like if you have your hip is not mobile, so what you do is you use a lot on your lower back. So things like bending, twisting, lifting, that's compensate on your lower back muscles to take the load. So therefore, we need to look at the hip mobility and not so much of the lumbar region. So that's what we meant by joint functions. So prevention and rehabilitation, I mean, two components are very key in terms of the healthcare aspect, right? But what's the difference between prevention and rehab? Prevention is basically to reduce the risk of injury before it happens, and rehabilitation is to restore the function after an illness, surgery, or an injury has occurred, right? So we've heard of this golfers and tennis elbow. So it's very specific to the sport, but it's not the case of only a golfer has golfer's elbow, the inner elbow, or tennis elbow, the outer bit, which we call lateral epicondylitis. So it can happen to anyone, basically using repetitive motion of the wrist, gripping, a lot of manual labor. So other sports like weightlifting and other manual heavy stuff that requires a lot of repetitive motion. Okay, so there we go.
Okay, so the benefits of improved mobility, first is enhanced performance. If your joints are mobile, means that you can train your speed, you can train your jump ability, agility. So basically, it's very important to incorporate mobility exercise into your weekly routine. A lot of people are lacking, especially mobility. They go straight to a workout without proper warm-up, and then injury happens. So basically, another thing is the injury prevention. as we mentioned, when joints are mobile, basically the body psychologically is also prepared to act and to perform various physical activities, and also it helps with everyday activities with general population, just doing day-by-day activities at home. Being a mobile can really benefit you long term and help you in the longevity process.
Absolutely. So, very simple things that you can do at home to assess your mobility. So, for example, Dimi, just do a squat for me. Okay, so the front in the mirror, you can see, if you can't get into the depth that he is in, maybe up here.
So basically,
Yeah,
you
basically
lean
it's
forward.
leaning forwards. So your leg of a lot using on a lot of your lumbar and thoracic, and then your hip.
It's basically
Yeah,
locked.
it's locked. So there's lack of limitation here, range. And then if your heels are off the ground,
The other
which
option
means
you
that your ankle
like this.
mobility is restricted. So that's a very simple test that you can do. So not everyone can go down to a very deep squat. So that's one of the tests.
Does anyone want to volunteer and try it out? Let's do it.
Come. Yes.
Yeah, they're right in front of you.
Multiple people to do it on the spot.
Let's do a quick assessment.
Yeah.
Okay, what I do is squat.
Yes, you
Squat.
perform like this. Then just perform a squat. Okay.
My jeans are a bit too tight.
Okay. Do you feel any limitations?
Do you feel
Anything? Do you
tight?
feel it tight?
Uh,
Except the jeans. The hip.
I mean, he's quite good to
Yes.
be fair. He's
Huh?
quite
Yeah,
good.
yeah.
Yeah. But some people like their knees will like start to cave
Cave in.
Then you know that there's some like lack of strength in your glutes
Okay.
as well, not just the range of motion. So
Good
I've got
mobility.
Yeah.
back issues.
Back-
Okay.
And,
Okay.
knees.
Okay.
Say that again. If your heel goes up,
If heels
that
out,
means the
then
ankles
your
are-
ankles are
Stiff.
basically
And if
stiff.
you're moving forward, it means your
Hip
is
as
Yes,
well.
your hip.
Yes. And also weak abdominal muscles as well.
Mostly, I would say that from my clinical experience, a lot of people go there's caving in.
okay.
There's a lack of the glute drive here. Yeah, so you can pull the hips outwards. Yes, that's quite common from my experience.
Yes.
Yes, so because the glute muscle is a big muscle in the body and it's the strongest one in the body. But however, to strengthen the glute muscles, we actually need to isolate them. And that's through like resistant work, load, basically going to gym
Yes.
and work out your glutes.
Yes, and work out your glutes. Yes.
Okay, so
We can help you also with specific exercises if you want to target some specific area. During the Q&A, you can just ask us, so we will
Yeah.
come with the solution.
Correct. So one of the things that we also found that is like shoulder flexions, simple things like this, like why do you need this for? Like even in everyday life, you need to reach out and get some stuff. But some people have lack of mobility. So if you see that you can go up here to your ear level, that's pretty good. So some people go here, we stop as a
Yes.
limited shoulder flexion.
Shoulder
Yes.
flexion, lats as well.
Yes.
Right?
Another thing is also like shoulder external rotation, which you need to like your swing during your
Especially if
tennis,
you're
your
playing
golf.
a
Yeah,
sport.
you need to get this range, but some people can't get to here. So that's impacts on their sports. Yes. Okay, so simple things like that you can test, and also reduce in muscle mass and weight gain. Clearly, if you are putting a bit of weight,
Yes.
and then it impacts on your joints because the load is on your joints. Yeah, so by reducing the weight, it actually helps with your speed, agility, and
Range of
basically
motion.
Your whole body
Everything.
moves better, right?
Yes.
And so when do you actually seek professionals like us, Dimi or me, myself? Basically, you have any persistent pain in your body for several days, that impacts on your daily activities, your sleep. Also, you feel any limitations in your range of motion or unable to move your limb freely, that's when you seek me. And any trauma, any pain in the body. Okay, and for Dimi,
For me, it's basically when you notice that you're lacking strength, you're lacking power, speed, you have excessive weight gain, during the last period of your life. So basically, we are trying to improve your human performance and protect you from injuries before it's too late, and then you have to go to Michelle to see Michelle, and then to work on your post rehab.
Basically. Yes, so you said like limitations of raising arm above, or like poor tennis form. That's just one of the examples. If you may find that in your sport, sometimes you don't really go and assess your range, and then you realize that, oh, why I can't get that stroke in. So you're not sure, come and look for us. I'll do an assessment, and then we'll know what are the deficits or limitations that you have in your body.
I think the assessment is the key.
Yeah.
You know, like if you are starting with any activities, we are basically advocating to go and seek a professional to assess your body limitations, asymmetries between left and right limbs, in
Muscle
order
imbalances,
exactly.
all of that. Yeah.
Yes, in order to have a easier start of your journey.
Okay, so let's get to now the mobility exercises that we can do. I mean, you guys can join in
Yes,
with
we
us
can.
with the space that we've got.
Yes.
So let's start.
We're gonna start first with the shoulder, and then we will go all the way down. So
Yep.
first the shoulder mobility, simple exercises. We're gonna mention later that like how much time you need to improve your mobility and your performance. So we're gonna catch up a little bit later. Then first we're gonna go through the exercise right now, so you are familiar, and also you can step in and try yourself if you want to see your limitations, or to talk with us if you have any issues performing these exercises. Okay, so the first one is the prone weighted shoulder butterflies. Can I go with the mic? It's okay.
It's okay.
I think it's okay.
Okay. Let me see if we have enough space
So
here.
just get a yoga mat on your floor, and then
Okay, so the first shoulder mobility exercise that everyone can perform at home is the shoulder butterfly. So basically you start from the top, and you need to go full circle around. Try to reach.
Yeah, if you guys can see it, just stand up.
Yes, try to reach with both arms here without compensating with your cervical spine. So cervical spine is a joint that needs to stay stable, right? So basically you can put your forehead on the floor, on the mat, against the mat, and then try to perform without compensating with any other joints or muscles. And of course, just keep breathing. Full range of motion, rotate the shoulders, reach, go back. Does anyone wants to come and try?
anyone?
No?
You can try.
Maybe another one that's.
Yeah.
In another one. Yes. Sure.
Okay,
Sure.
shoulder so
back and forth.
let me
Yes.
just demonstrate.
That one can everyone can try.
Go back, stretch out. So when you go back, you stretch your pecs and then come back forward. So shoulder flexion, it's a bit of flexion, external rotation, going back, stretching your pecs
You can show them
And
the
come
full all the way.
all the way.
We just
Yeah, you want to
you
try?
need to yes. There we go.
Okay.
So if you have your broom at home, just remove the bottom part.
Or an umbrella.
All the way at the end. Bring it up. Go all the way down. It would be hard.
It's quite hard, yeah.
But just go as far as you can and then bring it back up.
And the more mobile you get,
Yeah.
the closer your hands
Yeah.
can go.
And then if you can do this easily, then you can do around the world. All the way here. That means your shoulder mobilities are very good and it's not harming you.
Like it looks easy, but a lot of people
Yeah.
cannot perform like any of this, right?
I
Like
was-
they just
yeah.
get stuck in the middle,
I would
right?
say
Like
that if you can't get into that range, like how she is quite mobile, And then then you just go into the range that you're able
Yeah,
to,
why not?
and then come back. So don't force it all the way.
Yeah.
Yeah.
Don't force it, just go as far as you can.
As you can, yeah.
I don't know.
I can't go.
So over there. Start from here. Okay. Go back.
See the
Don't,
elbows bent.
don't bend the elbow, just go all the way down.
All the way. Yeah.
See, there's a bit of an elbow.
Nice.
There we go. Yes.
Very good.
Good.
Just slowly come up.
Slow.
Yes. That's good. Nice.
Do you feel any restrictions when you go, like any tightness, elbow in your elbows, wrist, shoulder?
No.
No, I'm
Okay.
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 Yeah.
That's nice.
Okay.
Yeah.
Try around the world.
How? Like
Yeah.
Rotate.
From here, go all the way up. All the way down. Great. Now, this up.
Nice.
Very
Very good. Do you play any sports?
just my back is not that good. So
Okay.
I'm trying to
Do you play any
learn
sport?
something. Yeah, I really have back problem.
Okay. Okay.
Lower lumbar.
Yeah, lower.
I mean, if you don't want to use a stick, you can also use a
Like
resistant
how You
band,
can use the band.
which is much more friendlier, I think. So you can adjust the resistance and you go down. So I think for me, the stick is hard
Yes.
as well. So
Yes.
resistant band is great. You can't find a stick, get a resistant band at gym. There we go. Okay.
Friendly solution.
Yes.
Or
Yeah.
towel.
And then for hip mobility, just gonna do
Yeah.
a 90-90 hip mobility. So sit like so, turn to the side, just go this way, and back. So it's internal, external rotation of the hip. It's very simple. And get your hip joint moving. So if anyone wants to try,
I don't want to try, but I've got a question. I've got
Yes.
terrible hips. I've got very tight hip flexors at the best of times. If you can't do that, what's your...
yes, if you can't do that, that's what we're going to go. Okay, so first of all, we need to see what are the structures in the hips that are tight. Yeah, so if your hip flexors, you may or may not go down that position. So hip flexion, you want to stretch your hip flexors. So this way, go stretch it. Okay, then you need to stand upright. So a lot of times people bend forwards and you can't feel anything because you're lunging forwards,
Right.
not really stretching. So stand upright, trunk upright, and you can feel more of the stretch. Tuck your tailbone under, then you can feel it. You wanna give it a go?
I'm not dressed appropriately, but you guys have Raffles Place. My office is... I live
Yeah.
in
So
the
for
office, it's,
advanced, they actually put the feet on the step,
right.
and then they go and then they stretch it. So it's
Sorry,
higher.
Robin, I
Yeah,
put
it's
both
harder.
as a horrible combination. So
But beginner, I would suggest that position.
And another
Okay.
option for you to consider, you will just lay down. Basically,
Right,
one leg above the other.
right.
You will put slight pressure, yeah? Or you can also like attach a resistant band on your hip to pull you that side.
Oh, yeah.
So without you assisting, then the band attached to something can pull you in that direction. So naturally will start,
Somebody can help you.
or somebody can help you.
Yeah.
Yes,
Easier.
yes,
But most of them, you don't have someone. So
yes.
I mean, it's all yoga
So,
poses.
and also
so-
some people like with this position, you can not only, this mostly stretches your piriformis, which is the one behind. So people might not feel the stretch on your hip flexors in the front.
Yes,
Yeah, so it really depends. I would say that,
assessment.
yeah,
And
we
how
need to
long would you guys
assess.
Sure. I'll pop by, but then how long do you guys would do like a set? How many reps or how many sets of like when you're doing these type of exercises?
To start with, I would go not more than 2 sets.
Okay, so I go to the gym, I
Yeah.
go run, blah blah blah. So I would say for myself, I'm not quite a beginner, right? So
Yeah, yeah. But you are not performing any of this.
No, I do. I do. Like I had a strength training session
Mm.
today, but I also run endurance running, and
Yeah,
I get really tight
hips.
with hips, especially. So
Yeah, so for me, if someone can get into the stretch, like yes, everyone, I need to assess the individual, and I do a lot of like manual techniques and also like dry needling to release the tension of the muscles first before I get my client to do a stretch. So if your muscles or your joints are so tight, you need to know which structures are tight. Is it a muscle? Is it the capsule? Is it the joint? There's so many structures in the body. So if it's too tight and you still put you in this position, you can't do it, you can't do it. So you have to, for me, it's to release work first, and then you activate the muscles, you stretch it, and then you activate it. Yes, so that's my approach.
How much time you spend on flexibility or not
So
really?
I do yoga. Like, so I run a couple of marathons a year. I train for them, and the training sucks the joy out of life, right? So I also like to play golf. So it's
Nice.
running and golf don't go hand in hand. It makes you stiff. Golf, you need to be.
Yeah.
Like we stretch twice a week, thrice a week, every day.
So I do yoga a few times a week if I'm in running season, but again, I know I'm not very flexible in terms of, you know.
Because
but that's something
we're coming to the frequency of how much you need to stretch and all that. Bear with us.
Yeah.
We go through.
After this, yes.
Yeah, after this, I'll talk about that. T-spine.
So T-spine is basically your thoracic spine, figure out your cervical, neck, thoracic, and lumbar region, lower back. The T-spine is the mid-spine. So if you want to get into the kneeling T-spine rotations, so against walls,
How do we sculpture? So T-spine is also one of the crucial joints that needs to be mobile, right? As a lot of people, basically because of the daily activities, actually is completely opposite, and it's not mobile at all, and it's they oftentimes they feel a lot of stiffness because of the position of the office hours sitting in front of the PC and the desk. So this one is amazing exercise to unlock the T-spine joint and work on your mobility. Also, it's not very how to say easy. It takes time to practice. The first part is pretty easy, right? So you need to connect to the wall. Basically, this part of the body doesn't move. With the other arm, you should try to stretch and open the T-spine. But then the second part is a bit more challenging. When you come back to this with the right arm, I want you to go all the way back.
It's like a clock face.
Yeah. Then you slide, open.
Next.
Slide. Full range of motion, open. So this is one of my favorites for unlocking the T-spine joint.
Yeah, can someone do this like standing up?
Can. Yeah, of course. Like you just need to go against the wall. If you can go down on your knee, it's better because when you stand up, our body try to find easier way to perform the exercises, so you will start compensating. Right? So if you cannot do like this, you will start turning the hip, rotating the hip just to be able to finish the exercise, right? Or then if you're not able here, you will start to basically arch your lower back just to be able to finish the rep. That's why we're recommending, if possible, to start on your knee because you're more stable. You're shutting down the lower body, so you cannot compensate with the lower body muscles.
Ideally, yeah.
Yes.
So of course, when we are playing a sport, you don't really want to get down on the ground in the middle of the golf course and start moving.
Yes.
So usually I'll just implement, like, for example, you have a golf club, do some dynamic motion. So we do a squat, and then we just rotate. Squat down and rotate up. So imagine this is your golf club, right? You can also put it over and then rotate your T-spine. Simple things like that. Okay, easy.
What you need to focus on is to work on the specific area that you are trying to improve. Don't just swing around and then use the whole body, right? So because in your mind you should put like, okay, I'm working on the T-spine. Let's move the T-spine without using the compensating muscles, the lower body. So during the Q&A, you can ask us about the specific region, and then we can come up with the solution.
Nice. And okay, so for ankle mobility, a lot of us don't really notice that we actually have some limitations to the ankle. So you always think of the knees, the hips, right, and then the spine. But then a lot of times the ankle, you lack of ankle mobility, you can't even do a squat because you have to get to this. This is also similar to this, right? So you can't flex your foot upwards. And in order to do that, you can do a very simple demonstration.
Yes. So I just want to show you a big mistake that people are doing is. So let's say this is the ankle mobility exercise, right? So they're gonna place the rubber band here. Everything is okay, and then what they're gonna do? They will try to stretch, but they're stretching with the lower back actually.
Yeah.
Right? So they think they're working on the ankle, but they're using the whole body to stretch. So we've come up with a better idea. Same exercise, you just need to put the leg on some ledge or
Platform?
just
Or step?
elevate on the box.
Yeah.
I don't know if we will be able to reach here. Try. Let's try.
This is really high.
No, it's very high.
It's very high. So just then I do it on the ground. Where you just lunge forwards.
Or the
That's fine. Just gently forwards. So the purpose of the bend is to create a force on the opposite direction when you're stretching forwards.
So it comes very naturally if you elevate the leg on something. Yeah, I would come here to try. Sure. But like, yeah, cannot just. The problem is I can't move the. Yeah.
I just need dots. There we go. Brown, it's explained.
Yeah.
So what does a resistant band do versus no
Yeah,
resistant
so
band?
wait, so you lunge forward.
So yes, so basically it pulls you in the opposite direction. So when you take out the resistant band, the joints can go much further.
So basically it's a mobilization, a self-mobilization technique.
But very important is to make sure that the joint is below this bone,
Ankle.
right? So a lot of people will put the band here, right? And then the joint is not there. And they do the same motion, but there is no benefit on it.
Right.
So you need to put the band below the bones, so you can force the joint to go back and forward.
Yes. Yes.
And another exercise that I'm performing with my athletes is the side to side inversion and reversion of the ankle. So basically you can just place your arms against the wall or something, and then you try to go from one side full to the other side, eversion and inversion. You will see that a lot of people cannot really move from this point to this point, right? So basically you can fix your knee and hip issues just by fixing the ankle mobility as well.
Step me to the great.
And
The knee also.
The knee?
yeah, so for
After the knee also.
Absolutely, yes. So because a lot of knee issues are happening because your ankles are not mobile. They're stiff. So stiffness in your ankle will cause instability in your knee joint. Yes.
yeah, so basically what is you mentioned limited ankle mobility. So what happens is you have compensatory strategies whereby then the load comes down to your knees are taking out the load, and it causes instability.
And then it goes to the hip,
Yes.
and then it goes to the shoulder.
Basically it's connected. Okay? And then that's what's dynamic. So all this is like you choose movement with it. So static stretching, there's a few for different joints. So shoulder joint, this is a very nice stretch for your posterior aspect of the shoulder. So a lot of people, they do this. So what happens, you can't feel the stretch because it's all compressed in the front of the shoulder. So what I do is up and across, and you can try it right now, actually sitting down, up and across, stretch
Aim to go diagonal, right?
Like
so if you
diagonally
go
up and
diagonally
across.
up, then you start feeling that
There we
something
go.
is pulling here. If you're doing
If you do
here,
this, try this, and then
I
you
don't
can't,
feel
you
anything.
can't feel anything. You feel everything is
Yeah.
compressed in the front. Right? Up and across, you feel the stretch instantly. And for more, you just rotate your body and then you get a T-spine stretch as well. Okay? And then for your hip joint, this is exactly what I've demonstrated as now, half kneeling for the hip flexor stretch. You go into this position. It doesn't have to be a static stretch though. It can be a dynamic. So you do this as a warm-up. Do a few couple of reps, maybe 5 to 10 reps, and get that stretch. There we go.
so we are always suggesting dynamic before the exercise, right?
Yeah.
Because to prepare the body for kind of like the positive fight or flight sympathetic nervous system, because static stretching benefit is to relax you, to relax your body. So basically, after performing a physical activity, we advocate always, we are suggesting for more static stretching to be able your body to shift from sympathetic to parasympathetic nervous system, which is the relaxation, digestion, clear mind, recovery, etc.
Yeah. So dynamic stretching also has a lot of like benefits in terms of if you can't get, not everyone can get a sustained a stretch.
And hold for
And
30,
it's very
45
uncomfortable.
seconds like this.
Yes. So it's very good to move. Research shows that dynamic stretching
It's better. And you, like he said, warm up the muscles, get your muscles prepped for the activity, whether it's your strength training, your sport. So it's really good to get in there. Okay? And we have the T-spine joint, which is the thoracic spine. Do you want to demonstrate the kneeling?
That was the
Okay. Okay.
challenging one, right?
Okay. So like all of us working on our desk,
You need to sit up.
I need to sit here. All right.
A
We're working on
simple.
laptops and work, and then your body is all stiff. Basically, this chair's a bit high, but if your office chair is a roller, right, even better. Just put your arms like that, and then you move your chair backwards, and then you stretch down, curl back up again, stretch down. So what you feel is like your lats are being stretched, your T-spine's moving, and get that mobility in.
But you gotta put some resistance on the elbows against the desk,
Yes.
right? So you gotta, when you go down, basically you press again against the desk to kind of open up the T-spine to
you
go
go.
in a full flexion and extension.
Okay. You can try it with your chair as a roller. It's way better. And yeah, so standing calf stretches. I realize that a lot of people do this and they start to stretch their calf. It doesn't put the muscle in an optimal length. It doesn't really stretch your calf. So normally, lean forwards, hold onto a wall if you need to, and heels on the ground firmly, lean forwards until you feel a stretch at the back of your calf. Okay, there you go. And then alternate. Same thing, lean forwards.
And the most common mistake is the lower back again, right? Like people usually will lean forward with the arch. Like
Yeah. So, and also the heels. For some of you, can't put your heels onto the ground, just closer, because your calves are tight. So make sure your back of your heels are always firmly on the ground. Lean forwards, hold that stretch, 10 to 15 seconds, come back up again. And go in again, 2 to 3 sets. There we go. Okay? Next. All right, so here we are. The suggested frequency for your mobility routine. So basically, recommended would be 2 to 3 times a week, 20 to 30 minutes per session. That's the ideally, we're supposed to do it. However, like we're all really busy, work and all that, make sure that you find a specific time and routine to fit into your routine. So you can incorporate all these mobility exercises, like all that we've demonstrated to you, like the dynamic warm-ups before your workout.
Before your workout, during your
Yes.
office hours, right? Like every 1 hour,
desk.
2 hours on the desk, just get up, you know, do few of
yeah.
these stretches. If it's possible, will benefit you on the long
right.
run.
It doesn't have to be like, you know, just get it in to wherever you have time in your day. It doesn't have to be, oh, I have to do 10 reps. I think if you do 3 times moving that like an hour, I think it'll be good.
Absolutely.
It'll benefit
Over time,
you. Yes.
over time will have a huge
Correct.
benefit.
And yes, if you're at home, like as I mentioned, the T-spine stretch on your desk. You can also hold on to something and stretch the wall, simple things like that. Okay? And figure of 8 stretch. So seated on the chair.
So this is another amazing one during your office hours, right? So the only problem is this is too high now,
Yes.
right? Usually your chair is a bit, you're sitting a little bit lower, so
Yep.
you can put a pressure with your upper body leaning
Yes.
forward to also open the hip.
So like what Dimi showed just now, you're on the ground, you can do it in seated position. Okay, if you can't,
Oh, I need
yeah,
to
can you hold this please?
Yes.
This is very high, but normally what I do is this arm, press down. So for some people that are tight, the hip will go this way. So in order to get the stretch at the back of your bottom here, glutes, and then you got to lean forwards into it, hold that stretch, and then come back again. Okay? You can try on that chair.
You just
Anyone
push
can
the-
try if you want.
You just need to push the, yes.
Yeah, so
Yes.
please sit out from your
Yes.
chairs. Yeah.
You
The
will
H.
start feeling like a, right, like a,
Yeah, you can't get into it, right? So just push your forearm right in there. What you feel is you feel the back of your glutes, but also the inner thigh that is also stretching at the same time. Okay? And, oh, it has gone.
That's just their TV's connection.
Okay.
okay,
It's back.
okay.
Yes, so another thing is that the upper trap stretch, I think most of you have, know. So a lot of us, we work, we're on our phones, laptops, we always get tightness over here. This is the upper traps. Yeah, we always compensate as well because other muscles are not as strong. So a very simple one, sitting on the chair. Let's say if I want to stretch this part, tuck your hand underneath. Lock it, lock your elbows, sit up nice and tall. On the other hand, opposite direction, we're going to stretch down, so arrow pointing downwards here, and we're going to stretch this way. And you can actually try right now to feel the stretch together with me. So pulling your arms all the way down on the opposite direction, and this hand just gently stretch it. You can feel the stretch. That's for your upper trapezius muscle. Can you feel it? And for another one is also the levator scap. You just diagonally downwards. In the same position, you'll feel a different muscle that is stretching. Okay, why is it important? Because the upper traps, right, when we compensate, that's why you always have tension here, but you hear people get a lot of headaches because the attachment of the muscle all the way into your cervical region at the top here. So it's very common that this causes a lot of headaches and tension headaches, basically. So it's very important to stretch the muscle and move. Okay?
Also not enough blood flow going to your brain.
Yeah. All right. Nice. And yeah, we did the cross body stretch, and basically setting realistic goals is key. Clearly, if you plan to do, say, once a day.
Be more specific when you're setting like goals. Let's say you want to improve your hip mobility. Just be specific that for the next 1 month, I will dedicate 3 times per week, 20 minutes each time to improve my my hip mobility, and then try to track that for any improvement, right? Like after 1 month, try the same exercise and then just assess yourself where like what was my starting point and where I'm at right now. There is tons of app, right?
Correct. if you have a specific goal, like you want to improve your sports performance, clearly, like you said, if you have tight hips, you definitely want to improve your hip mobility. So by that, you already have a goal, and then you stick to it. So don't feel really stressed that you have to do like 2 to 3 times a week. Like I just said, incorporate in your daily activities. Simple things like even standing, doing your, cooking your meal. You're tired, right? Waiting, you can just stretch.
Yeah.
Yeah, anywhere, basically. In your home, you don't really need an equipment to do so. Just get your body moving, okay? And there we go. So now we talk about nutrition and recovery. So foods that support joint health.
Yes. So many times when it comes to joint issues means that inflammatory processes are increased in our body. So basically we need to optimize our nutrition to bring that inflammation down in our body. So I just want to differentiate and make a difference between a general population and sport performance. When general population comes and visit us, we are designing a little bit different nutrition plan, because we can play with the macronutrients ratio and be more rigid, right? But when it comes to sport performance, basically recovery is the most important part while you're playing sports. So I would like to say that playing with those carbohydrates and proteins, it's all good, but we need to monitor your physical activity. If you're running every day, if you're active all the time, you're playing sports, you cannot restrict the carbohydrates too low, right? Because our body won't be able to recover during its natural processes. So basically, when it comes to joint health, we are always suggesting to include type of foods that it's anti-inflammatory, which is more like a berries, if you're picking up the fruits. Then also turmeric, because it contains a curcumin. So curcumin has a powerful anti-inflammatory strategy to work against your inflammation processes within the body. Then another one is the fatty fish, because of the omega-3 fatty acids. Or you can also supplement with omega-3. What else? Ginger is helpful. Yes. And then, but the even more important is the sleep. So, the new generations and the fast pace that we are living in, we are struggling so much with sleep. I'm always saying that, like the sleep is the one thing that can lift all the ships from the harbor in the same time, but only by improving your sleep. But because all the hormonal processes, all the recovery part of the muscles and joints, inflammation, you can heal naturally if you improve your sleep. Hydration as well, as we know, usually people are drinking less than 1 liter or 1 liter of water, which is not sufficient amount for recovery. And again, if you're playing sports, if you're active, especially in the Singapore climate, right, which is like crazy humid, right, yes, and then you sweat all the time, you should also add electrolytes to your drinks. That's a must, right? Like during the session and 1 to 2 hours after a physical activity, you should still drinking and replenish the electrolytes within your body.
Yeah, so I think ideally,
recovery.
So techniques. Sleep is key. This is ideal. However, you have 7 to 8 hours of sleep that is not quality sleep is also bad. So like what Jimmy says, is important for your recovery. You can do a lot of sport, you increase levels of activities, but you don't have enough sleep, your muscles can't recover. So therefore, you have higher risk of getting injuries. Yes. So let's say I work out 7 times a week, but I have poor sleep, that's not going to help with the body's recovery process. And also he mentions the food, like if you don't want supplement, you can take like natural foods, like whole foods, like salmon, and then like tuna, not from the tin, but like proper, the fresh ones, that would be good for your body. And then, yes, so other recovery techniques that people do is really based on their activity levels. So things like relaxation techniques can be your breathing techniques, right? Meditation, yoga, sauna, and ice bath, which is like the most popular. I would say that, if people who have high levels of activity and sports, they do ice bath because they want their muscles to reduce the inflammatory process. So that's why they go for it. But it's not necessary. It's just one of the options that you can use for recovery. There you go.
Amazing.
Right, so it's really short on what I've treated a lot of golfers, tennis players, powerlifters, and among a lot of other sports. For golfers, yes, there's always like tight hips, tight spine mobility. So I work with a lot of like mobility drills. Some sort of what he mentioned, but I also implement the release of the muscles before my mobility work. And corrective exercise to improve and strengthening the muscles around the body. Like your core, your hips, and surrounding
Knees.
muscles, yes, correct. And for tennis, a lot of shoulder limitations. So for example, someone wants to improve their shoulder external rotation, there are certain exercises that we can do for stretching or strengthening. So a lot of rotator cuff work that we will do as well. Yeah, but of course it's case by case basis. You come in, we need to assess, everyone's body is different. So everyone suffering from, example, lower back pain may not be the same for another person. So that's why our exercise plans are very individualized based on the person's body. Okay, so.
And also a lot of people, like a general population or the weekend warriors, like who are playing sports, come to visit us and they complain, let's say, like too much pain in the forearm if they're doing tennis or golf elbows. So basically, after the assessment, we many times we have realized that they don't know how to use their body to, start up the engine from the core. So basically, instead of using the whole body to generate force, they're actually just gripping the racket, and they're using the forearms so much without engaging the core and the rotation muscle, because the whole power comes from the hip and core. Doesn't come. They think that the whole power comes from the forearms, basically. But actually, you need to engage the whole core, hip rotation, mobility again, in order to produce force and strikes.
So basically, we will train you to how to use the certain muscles for that particular movement.
Yes.
Yeah, so it's not just the wrist or shoulder, it comes from other parts of your body, like
full body attention.
So the proper technique of doing the sport as well. So for both of us plays a very different role. For Demi, it's preventive and improve the performance of the sport. For me, it's recovery and rehabilitation, whereby you could prevent but also rehab after an injury.
So many times what we are doing in our gym is we send the person to Michelle first. She do the whole assessment. We call it like needs analysis. And then she report back to me with the whole case study, right, based on a particular individual. And then we create the program to work on those muscle imbalances, to increase the mobility. And then once we have the foundation, then we can work on the speed, power, agility, moving better, strength, muscle gains, fat loss, etc.
So for example, if someone wants to, someone wants to live in the gym, but they have certain injuries or pre-existing illness and injuries, they still want to get into the sport or lifting weights, then it's my role to help them to get to where they want to be by treating their pain, their range of motion, and then Demi will come in with the form. And so sometimes they have knee pain, for example. They can't do certain exercises. That's where we work together and tell them these are things to avoid and what things to work on So yeah, we work really well. So that's what makes us very different from T Squared, because we are a gym that we work very well holistically. So the PTs, the physios, and we have stretch therapies and all that.
Yes.
So
Amazing.
yeah.
Okay, so this is just a recap of the key points. I'm always saying that mobility training is a strength training. If you improve your mobility, your whole performance and basically your life will improve
Yes.
along the way. So call to action, right? You must dedicate specific time to work on your mobility in order to have improvements, right? Like just saying, oh, I need to work on this, and then 1 month later, you've done only once or twice. That's not enough. It takes time for a body to learn the new processes and to have the new muscle-mind connection or mind-joint connection, right? Like, yeah. So I think that now we can go for Q&A.
Yeah.
Yeah, and then we would like to hear more of your stories and what's your issues. Yeah, and then let's try to help.
Yeah, so I think that's it for the session. Any questions from?
I know that you all mentioned assessment.
Yep.
Can you just come in and you just do an assessment and tell us which joint? Okay.
Yeah, so you've got the details. You can come anytime. I guess well, I had a sorry, go on.
No, and what do you do in the assessment? Would you tell me which joint?
Yeah, so it really depends. Like for some clients that come in, they already have a diagnosis from a doctor or their pre-existing conditions, but they don't, and they feel like there's some limitations. They don't know what's going on. That's my role to assess like their range of motion, their flexibility, a lot of special tests that we do based on the questionnaires that we get from you, like your subjective questioning and understanding like what the issues that you're suffering from. Yes.
And also, what is your goal? What do you want to achieve after that assessment, right?
Yes.
Like, are you planning to play some sport, or do you want just to function normally, day-to-day basis? Like, what's your goal is also very, very
that
important.
will be our exercise plans for you. So that's why it's very individualized, depending on your goals, what you want to achieve. Yes.
So do you assess what is the muscle content, body fat, all of that as part of the assessment?
That will be DME.
Yes.
So it's
Yes.
So just as an anecdote, so I've been going to them. I've got no ACL, no meniscus, no cartilage.
Right.
But I don't want to play sports, so I'm not doing surgery, I'm not playing sports. But the entire focus is strengthening my supporting muscles, so I don't need surgery later in life, because my everyday movements are fine. So I think that's what the anecdotal evidence is in terms of case by case. And
it may not be an injury, but also people come for like recovery. For example, an athlete, they just want to maintain their body so that prevent them from further injuries along the way. Yes.
Do you guys also do like injury rectification? Like I have plantar fasciitis on and off. Is that something you guys would also?
Yes. Basically, I see from the top to the toe, all the body, like muscles, nerves, like you mentioned, plantar fasciitis, shoulder pain, impingement, all of the above. But I also, I also specialize in neuro rehab, which is like stroke, Parkinson's, and a lot of brain injuries. Like it's a different rehab program, but it's also one of my specialty. So
part of the holistic aim we're going for is living better while you're around. So we've also partnered with medical providers for blood tests, hormone work, testosterone levels. So these are some of the future talks where you get the work done so that there is a connectivity between your sports athlete or your injuries and or your medical work. And then the interventions usually are what we always know, which is sleep well, drink better, and exercise. But within that, the nuances is where we step in.
So versus a fitness first or any of these other chappies who generally, they have their trainers, your focus is a bit on diagnostics, healing, holistic.
Yeah. So my anecdote with them was often when I've been training for 14, 15 years, I think transformations for some are the primary goal. And so for transformations, there are cookie cutter programs that are very effective. 12 reps, 4 sets, 5 reps, 3 sets, and they work. They may not be
1,002 calories.
1,002 calories.
Yeah.
But is it for me? Does it hurt? So the reason I went here was I couldn't do those programs because yes, they might transform my body fat, but my knee would be shot and I need surgery. So the focus here is your abs may be a byproduct, but your underlying goal may not be abs. It may be run more. It may be I just want to get into sports that I missed doing 5 years ago.
I could play tennis, but
Yes.
now I
Yeah.
can't, so I want to get back.
Yeah,
That's right.
correct. And then so you just aim and focus on that. So maybe you don't lift that heavy. You don't need to.
Yes.
Maybe you're doing your shoulder joints and your core so that you won't hurt yourself.
Correct.
So that's sort of the focus. And then by default, you'll end up getting fitter.
And where is your office and all of this?
So there's two. There's Harbourfront and Raffles. So
That's
either are an option, really. Yeah. But like I said, I think the focus is more education. So ask anything you want. The rest of it is secondary.
Yes.
A couple of questions.
Yep.
I've got a specific question around pain, which is, I guess, it's a golfer's elbow. Right? What
Yep.
are some of the exercises you can do to because it's at the bone, it's really painful
Yes.
when you try and push, like that's when you're surfing, you try and push
Mm.
off. It's very painful. The other question I have is, like, what do you guys think of this knees over toes guy?
Wow.
Good. Explain it. Okay, I'll explain the golfer's elbow. So, I mean, like I said, everyone is different. So the pain, someone perceives pain can be different from another person, right? The pain also can, for example, is a very long standing pain. So, example, if your pain was like 7/10, really painful, but over the years it become 2/10, but actually the pain is still there. It's just that your body has adapted or desensitized, which means that it's not good because you're desensitized to the pain. Your body is still having that injury there, and you keep doing the same thing over and over again. So what happens is that it leads to other issues like slower recovery rate. Because now you're doing it with the tendons. The muscles have a lot of nerve supply, but tendons don't have much blood supply there. So healing process takes a longer recovery time. So it's very key to come in immediately if you have pain in your body and you know it's like very specific, come in for a check. So a lot of times that people don't know that what's going on. It's like, oh, there's a dull ache. They're not sure why, but they're still doing strength training and all their sport. And then when I do the whole full assessment and then realize that they might need a scan, that's when I come in and said, I think you need to go and see a doctor for a scan. And then they have a scan done and it's a fracture. But the pain,
stress
yes,
fracture, right? Like
it can be anything, yeah. It may not be severe, it may be quite severe, and then you don't know, you're still doing the movements, and it's actually making the problem worse. So further injuring, yeah. So for golfers, yeah. The stretches just like stretching your wrists, yeah, things like that. But the thing is that you need to know at which phase you need to do your exercise programs. So I can't just ask you to do the whole like full-blown stretches and all that, and then you don't know how severe has your injury been. Yeah.
is there any muscle tightness around that pain? Like to feel that it's, like, I don't like, sometimes I feel like, okay, if it's pain here, I can feel that my forearm basically is stiff, like it's like hard. Do you have any?
Forearm here, but it's usually when you're pushing off something.
Yeah.
You're trying to push off.
Yeah.
Then it comes.
It also.
But right now there's no pain.
Could be
Yeah.
from somewhere.
Yeah, I was gonna say it can be other parts of your body. So I have people that go, I got a tennis elbow,
But it's
elbow.
the shoulder.
When I check, it's not the tennis elbow. It's actually the biceps or the shoulder bit. So that's when you need to come in and let me assess you. It's very hard for me to tell you like, oh, simple stretches, but it might not.
You can try the trigger ball as well, the massage ball, against the wall or against the table, to go to a specific area of the muscle where you feel the tension and to roll that part. Because sometimes can be a knots in the muscle that causes blood restriction and make the area tight, right? So usually I like the small massage ball and play around to see if if it improves.
Yeah.
Or you can
But-
have ice in a cloth and just put your that spot.
If it's a, but
Release
yeah,
pain.
first thing is it the bone or is it the muscle, right?
Yeah,
So that's also very,
Yeah.
very important
That
to,
is-
to
yes.
assess.
Correct. So that's why you need me to come in and assess.
Yeah, of
Because
course.
some people like, oh, there's tightness, it's gonna get a ball, roll, and it doesn't work. It probably relieve you for a few days, a week, and then it comes back again. So because the muscles are so tight sometimes that you cannot use external force to just roll onto the external bit. You need something like dry needling, which I do. So you get right into the muscle belly, twitch the muscle, and there's a lot of physiological benefits to it. So sometimes it's not just stretching, it's not just rolling over
Rolling,
your
yeah.
muscles, yeah.
Because also can cause
It doesn't-
additional stress.
Correct. It
If it's
doesn't
stress
like
and then you,
target the root cause. So that's why I need to really screen through your whole history of your issues. Yeah. You have this problem for how long already?
Actually, it's not not the most
Okay.
concerning part.
Yeah.
Maybe we'll, we'll take that one offline.
Yeah.
The other question about the knees of the toes, guys, what do you guys think of
Knees.
his,
what's the
Yeah.
purpose?
That's what I was gonna ask.
What's the purpose of so basically the guy for mobility purposes is good, but we are not suggesting knees over toes if you want to improve, let's say, speed, agility, muscle mass, right? Because in that position it's very, especially because we are working with weights, it's very hard to keep the body stable with load. With light load and everything, it will improve your mobility, like no issues. But then if you want to gain muscles, improve your speed and like quickness or jump, we are not like how to say big
Advocates.
advocates
Depends
on.
when you're
No,
lunging.
so it's really mobility and strength. Like to Varun's point, my knees are also
Shape.
pretty busted, meniscus torn,
Okay.
so on and so forth. ACL.
Yeah.
So it's really from that point of view,
Yeah.
mobility and strength, right? So that your knees
Yeah.
are more stable. And
Yeah,
you can do exercises. You can,
yeah.
Yeah, well, you can do exercise, but you know what type of exercise to target which muscles at what point of time.
But in
Yeah.
short, I think the knees over toe guy is good. He's very, you have to be careful on your knees, and that the more you bend your knee, your joints are opening up, your ligaments are twisting. So I don't do any knees over toe because I don't have the ligaments to allow for that. It can dislocate my joint. If I did, then the lighter weights, goblet squats with knees over toe, great. Walking lunges, lighter weight, calf to hamstring, knees over toe, great. If you're going heavy, avoid that because then you're straining parts that aren't needed. So I think you kind of have your variance on the lighter the weight, the more the range of motion. The heavier the weight, lose up on the range of motion just to prevent the injury is kind of what we look at.
Because the knee is like, the bone is like this, right? Like with the kneecap, if you put too much force, this one slides. Because your body cannot take the force that you're putting on the body. So basically, if you're having issues with your ACL or meniscus, you're putting your body in a position either for ACL or the kneecap to go side to side.
I mean, like he said, depends on what your goal is, like what you want to strengthen. Like I wouldn't say really focus on the knee over toes. From what he said, Varun said, if you have ligament tears and all that, then we need to know what are the movements to not get into. Yes, he's right about stretching, knee flexion. You overstretch your ligaments in the knees and causing more damage. Yes, but however, you know that people that have torn ACLs completely and still able to perform a sport. Yes. So
What sport do you play?
tennis, golf, beach volleyball.
Okay,
skiing.
okay.
So
You should always think about that. Is this movement, let's say knee over toe, is mimicking my sport movement? Because like very rarely the actual sports requires from you to go in that depth to put that much force on the ankle and the knee joint in order to produce some sport movement, right? Because that's why I'm always asking, you know, basketball position the most is this, right? Like, let's say stability. So I would like to work with the players in that position and make them very strong in that position in comparing to going just in knee over toes all the way down. This is too much pressure on the ankle and the knee, too much pressure. For mobility, amazing,
Yes.
without loads. But if you put heavy, you know, like loads, dumbbells or barbell, you know, like this is not a favorable position for our body to bring all the force back, right? Because when you go all the way back, the knee, right, needs to be stable. Many times, you know, like your body cannot take the load, then injury occurs.
And why the body can't take the load is probably like other muscles in your body doesn't support it. So often we say not only the tightness but also the strength of the glutes.
Glute.
Yes.
To bring you all the way
up.
back. Yeah.
Any other questions?
Yeah, well, how would you guys also deal with, like, identify and deal with instability? Because, you know, both sides aren't, you know, you typically have one side which is more dominant than others,
Correct.
or when you do some sports, you also have things that overcompensate and then become disproportionately stronger or weaker, and that causes typically injuries as well, right? So
Yes, correct. So your question is with one side of the body.
At what point do you, I mean, okay, you can, that's for some people, you know, the more you do, maybe you start off, it's not as noticeable. If you do something for a long time, that amplifies into, you know, real, let's say, let's say one side is weaker or stronger than the other. Also, some muscle groups are stronger or weaker. At what point do you find the balance where things are a little bit normalized?
Yeah,
Like,
so for us, we always include unilateral work into our workouts. So it's very important to also do single leg or single limb exercises because our bodies we always have muscle imbalance. No matter how we want to strengthen both, there's always some asymmetry. Yes, but to balance that out, we always have to work on the weaker one, which is the unilateral work, like single leg, RDLs, everything. So we need to include at least one or two single leg exercise or limb exercises into the exercise program.
So
That's how we.
This is the typical. You go to a transformation, barbell squat, deadlift are a must.
Leg press machine.
Yes.
Whereas for me, I don't deadlift at all. I only use unilateral dumbbell RDLs. Will I get the same result? 80% actually, 80, 85. But I don't do a deadlift at all. Because I would have imbalances and I can't. So I think that's the difference where most facilities would not recommend unilateral because the progression is a bit slower. But if that's your focus and that's your goal, then I think that's the slight difference on just understanding your need.
I think it's very important to do a unilateral work because you will realize very quickly that when you do unilateral work, your double limb will have a lot more stability and control and strength to do your sport very quickly.
And I think at what point, for everyone, just start off on unilateral, day one. And if you're struggling, reduce the weight, increase the tempo, increase the time under tension. And you should start seeing balances within 2 to 3 months, if not sooner, depending on how extreme. Post-injury, it took me 3 months to get my calf similar. It doesn't really look similar because I'm perpetually compensating on my right leg. But at least my difference is only 10% apart now within 3 months. So if I wasn't injured and if you're not injured, 1 to 2 months, you'll start seeing the balance coming through.
So do you guys advocate like taping and stuff to...
Taping. I don't really do a lot of taping because I feel like...
Taping for injuries or for...
Yes.
For both, like, so when I run my physio, you know, got my left hip I go through phases, my left hip, my recent race was, you know, pre that, I get a lot more fatigue, I get a lot more, let's say, achy on one side, so I'm, you know, but for me taping, it's quite, it's incredible where how quickly you know for a short term it increases strength and you know from a short term fixed perspective, right? So like I tape my
Hip.
hip and glutes.
Basically, do you tape so your body doesn't go like in excessive range of motion?
No, I think it's more from a strength perspective.
For support, right?
Okay.
For support,
Yeah.
yes.
Okay.
Exactly what you said. So it's like a short term. It helps, especially when you're doing a sport. You're going for a run or marathon. You do a taping, then it does help to give you the extra support. But in the long term, it's not ideal because you definitely still want to strengthen the muscles, the weak
so
muscles.
it's make you weaker.
No, it actually surprisingly it's funny. I started off it pretty weak on the left side.
Yeah.
After taping for a couple of months, that became
less
stronger. As I go see a physio every now and then.
And I'm sure you do all the rehab work as well, right? Yeah.
No, and I've started off I've started doing strength training sessions.
Yes.
I do a few marathons a year, so you know.
Yeah, because it's a very different scenarios. Because I don't know, when, let's say when I was working with the basketball team, we are taping them so they don't go in that range of motion if they have
Yeah, so this is like KT tape.
Yes. Right, and the other tape that you are mentioning also can be incorporated to activate muscles, right? The muscle that is basically asleep to activate, to start firing up in order for your body and mind to start recognizing that motion.
Or just strengthening. I mean, it's just.
Yeah, like if it helps, of course. Like we will never say, you know, like please don't do that. You know, like it's gonna harm your body or something.
It's definitely not harmful, but in the long term, you definitely want to strengthen it. Like short term, yes, you want to perform the sport, definitely helps. You get that external feedback onto your joints.
And what would be your philosophy for treating something like, say, plantar fasciitis?
Yep.
Like, what would be your philosophy in terms of?
Plantar
Because there are two big schools of thoughts, right? One is get inserts, or the second is release your fascia to.
All of that is not wrong.
I'm just curious.
It's good. It's good that for insoles, it's really good to give you the extra support when you're walking, so it reduces the tension on the plantar fascia. But ideally, we still need to strengthen the foot muscles to get it strong. So, for example, if someone has flat foot, and they always rely on the insert, for the arch. So your body actually recognizes that now you need that particular support in order to move better, less pain. But does that fix the long-term problem? No.
Philosophy, essentially try and not use insoles or...
No, because I use the trigger, I use a spiky ball basically to just release.
But do you know if you have a flat?
No, I don't have flat feet, but I got plantar because of golf. I was playing a lot of golf in December last year. And
so what do you recommend?
So all the stretches, all the massage is really good for that. But ultimately, you still need to do some strengthening work to strengthen your foot muscles and get that arch or to reduce the tension of the fascia. Because now sometimes the fascia is stretched into a position where it's inflamed. Right.
Okay.
So if you get that support, it's still great for your foot.
Which exercises would you recommend for plantar?
For this, there's a lot.
Like the top two.
Yeah, I mean, like if let's say, okay, normally we do it on the big toe. We just stretch out your big toe.
Right.
Or what do you normally do for your?
Because I had my foot taped for and that was the rigid tape. That was not the KT tape. I had that taped up for almost most of this year. Now it's disappeared. I've not been running for a month, but
you can stretch.
You're scared to go back.
Now I'm running. I'm signed up for running the half in Stanshot. I'm running Tokyo and London and maybe Boston. I'm waiting on Boston next year, but I'm running at least two. So it's something strength training now.
Yeah.
Stretching is great. Yeah, but also we think about not just the foot. It's also the calf, the calf muscles.
But for me, like a spiky ball is just 3 minutes.
Rolling, that's fine. Yeah, and then stretching your calves. Don't forget about this part too, because a lot of people think that it's just down here the fascia, but then your Achilles tendon attaches all the way down to your foot, and it comes up here.
I think the number one ignored thing, calf workouts.
Yeah.
Because it's lightweight, it's boring. The calf's being worked out when you're squatting. The calf's being worked out when you're lunging. but it's not really being focused on. So it's shocking. You do just calf raises. It's either seated on a plate or standing with like a hold thing, stand on the back of a bench. So you've got a small calf raise. You will be sore for a couple of days and not walk correct. So most people, I was ignoring calf workouts, and essentially they said, well, yes, your hamstring and your quads are strong, but that's weak, and you're still compensating on both ankle and or knee. So calf workouts would be probably the most overlooked ones in bodybuilding or training because they seem like the smallest muscle group, but super critical to the whole chain. So calf workouts.
Calf stretching. A lot of people, when they do calf stretching, like not only this, he said elevated on a step, they focus on the upward motion. But if you look at the mechanics, it's the downward motion that gives you the stretch.
Eccentric, basically.
Exactly, the eccentric movements. So a lot of our workouts, we also focus on eccentric control rather than rep by rep. We just focus on the coming down, the lengthening of the muscles.
So
That's what I meant.
I have a sock as well, which basically you sleep at night with basically just
Splint?
not splint. It's for the plantar again. It's basically just lifting your.
And also try with just a small towel, barefoot.
Yeah, just pull it. Yeah,
No, to with your fingers.
Right.
To grasp the towel and to release. Try on that leg to see if there is any difference between the left and right. Can you control all the toes on your foot to grasp the towel, right? And then also that's a mobility as well, right? So
and
that's
strength.
another strength of the arc as well, right?
Yes.
Just try to grasp and release the towel as an exercise. Just incorporate that to see if it's gonna be any difference.
But make sure you do stretch your whole body, please.
Yeah.
No, it's you have to. It's your body won't take.
Yeah. Have someone do the stretch for you. Find a stretch therapist, and then do a nice Japanese stretch. You know, like doctor stretch.
The lower
Those
back.
are the best.
Yeah.
Let's explain us.
I always easily injure my lower back.
Why?
What's
the
your
posture and yeah.
What
do you do
things?
any
Carry
exercise?
the luggage and then it's a bit heavy. Then I feel that I just sprained it when I was carrying the luggage at the airport. So sometimes I do a lot of sports as well, like tennis and yeah.
Do you work on the core?
No, I don't think so. I really need to work.
Exactly.
The strengthening, right? So getting in the sport is so different, right? So you need to prepare your muscles for the activity. I always say that. So it's.
I also have some issues which I feel weird that I notice some cracking sound when I move that in the joints and bones. It's quite loud. I'm scared of it.
Not all the time.
Yes, it's okay. It's okay. Yes, keep going. Keep going.
People outnumber. They said, "Oh, it's okay. It's normal." But for me, it's scary.
The sound of it, there's also a bit of like instability. It's like indication of instability because when your joints are as long as there's no sharp pain, there's nothing that
it's not painful.
No worries. No worries.
That's a very great
still have
solution.
long way to go. Don't worry.
I mean, our body is just a skeletal, so think of it like a building without any plastering on it. So if your building is not stable, then you just everywhere will start to click, everywhere will start to move, quite mobile. And then when you carry your your daily activities, therefore just like simple things like carrying out a luggage, you need to brace your core. But what is bracing?
I always like squat and
squat.
You put down the
luggage.
Yes. And I'm squatting like that.
Yes.
And then after that, I know. It's been 3 weeks.
Come and see. To help you.
Actually, the doctor referred me to the physiotherapy. But I'm not sure. Because it's under our corporate insurance, is it? Can I claim it actually if I go to your I don't know how it works.
Yes, actually usually physiotherapy treatment is claimable by insurance. Just check with your insurance company. Like most of my clients actually claim via insurance.
Yeah, but it has to be in the first year of your
It really
surgery.
depends
That's
on
how it normally is.
Yeah.
You can't claim. You
Because
could have had a surgery 2 years ago. Today,
Actually-
if you go for physio,
But you know,
That's
No, actually, really,
Yeah,
it really
yeah.
depends. It really
I
depends
get,
on your
I
company,
think
so
so, I
insurance.
guess.
sessions a year or something.
Yeah.
so it depends what you have.
Yeah.
yeah, because I
Normally,
just had an injury like 3 weeks ago. I know for the TCM, they have to register TCM for the
Yeah, TCM is not. So
TCM's,
in
yeah.
Singapore, insurance is, you have to be a qualified allied health, which means TCM and chiropractor, very few insurance coverage. Some do. You just have to check. Physiotherapy is considered under medical. And so most insurances will have coverage,
Yeah.
but depending on your coverage,
Correct.
it's a certain budget per year. And so you might have 5 sessions, 10, 15.
Okay.
So, and there it's, you don't have to say, hey, do you cover provider 1, physio 2, physio 3? You just say, do you cover physio?
I see.
Then you pay
Yeah, I'll
and you
check
claim
with
that.
them and,
Yeah, it's best to check, yeah.
So I normally go, pay, and then send my bill to my insurer.
Yeah,
and then they
because
cover
I always do acupuncture and
Yeah.
whenever I have the injury. So.
it. I
Yeah,
think-
but I think in the end I need to know the right posture, the
Correct.
core
And you need to
Yeah,
strengthen
that's
strengthen
correct.
your body.
Yeah.
You gotta build the foundation, right? Everything is there. Once you have the foundation, it's easier to work around. Yes.
Preventive.
Yes.
So I think the 3 exercises stereotype. I mean, for most that are starting off, calves, glutes, and core. Glutes and core, most people know, or they think about it. As someone that was training, I don't want to train my abs. Training abs is useless. You can't see abs if you train abs. Yeah, I'm just going to squat, get strong, get lean, I'll see my abs. But in reality, sure, that worked. But not training them meant I was compensating getting hurt. So I think for any sports performance, and what they were saying earlier, tennis elbow, tough wrist, you're compensating. If you have a good core, you're going to power through most motions, even running. Running is glutes, hamstrings. So the overlooked are the calves, glutes for guys. Most women do like working out glutes, but glutes, calves, and core. And mostly on the core, try and, sure, shut-ups are great, but focus on dynamic core. So leg lifts, rotation with weight. So emulate movement,
Yeah.
and you'll get, those are the 3 that we'd recommend.
But also if you have
Yeah,
like
sorry.
pains in your body and certain movements like leg lifts is not great for lower back pain. So I think it's like what to do, what type of exercise to do.
Yeah.
That's important. Yeah.
Thank
Yeah,
you.
I think I
Thank
need
you.
to
Then-
explain
Thank
to
you.
people
Thank you.
and,
Thank you, guys.
cool down, which I'm lazy to do always. I just go and play.
Yes, and also like he said core workout, right? Like core is not just abdominal workout like sit-ups and all that. Core can entail like your back, your hips, your
Hips,
glutes,
yeah.
your legs. Like,
Everything
all
is
this
core.
is core.
I know I'm not strong.
Yeah. So remember, not just like sit ups all the time. Yeah. And also like your pelvic floor. The pelvic floor, a lot of people think, oh, it's just for women. No, men has pelvic floor too. How it supports our bladder, stomach, all that. It's the inner muscles. How do we activate that? Then we can learn from us.
Also about this ice bath, it's very popular
Yeah.
these days.
Correct.
I'm Chinese. I mean,
It's cold and bad, right?
I'm trying.
I'm not saying it's not good. I'm just saying TCM.
Yeah.
Somewhere
Avoid
they always
cold.
tell us,
Yeah, the
don't
cold.
drink too icy water or not too cold. And as a girl,
Oh no.
so I'm just thinking, should I do it?
No,
So you
yeah.
know what I mean? It's pretty cold. I tried.
Okay, yeah, try. Basically, I'm a Chinese too. I know about the hot, cold, and all that.
Yeah.
It doesn't impact on your body. Like I drink cold water every
So
single day.
drinking versus outside is 2
Yeah,
different things.
yeah. I mean, like, yeah, that it doesn't do
Jump into
any.
icy water.
Yes, usually people do the sauna for a few minutes and then they go into the ice bath.
Really?
Yes.
So-
to warm up
And
and
then
then
back
go
and forth.
back and forth. So
I thought they
because
usually
your
tell you
body.
don't do
No.
too hot. You want to go cold shower, ice bath,
No, so
No.
there's different
air
protocols.
dry, basically.
So
right?
1880 has
The hot
sauna and ice.
infrared,
Hot
yeah,
infrared.
Yeah.
We've, I've done a few. Essentially, there's 2 protocols, which if you're doing just a sauna, great to wind down for the night. it calms you down, heats you up. You're getting ready for bed, turn on the aircon. But do a
Parasympathetic.
sauna.
Yeah.
The morning,
Nervous.
do a cold to wake up and just get going. But even for hot cold protocols, there's for the cold. Firstly, there's two. If you're going for, let's say, 1 to 3 degrees, you want to do 30 seconds to 90 seconds because it's an internal blood detox and flush. If you're doing 8 to 10 degrees, then you can stay for like 5 to 8 minutes and feel the anti-inflammatory. The contrast therapy is more for longevity blood flush, which you're doing a 20-minute or 10-minute sauna, 1 minute ice. So you're purposely shocking the system
Right.
to the way you do a juice cleanse for your gut. That hot cold is a flush for your bloods and your organs. For anti-inflammatory, I do it twice a week, but I do it 8 to 10. The one thing to note though is if you're doing ice baths right after a workout, technically you're being anti-productive because the muscles grow by tearing. Inflammation comes in, inflammation repairs the muscles, your muscles grow. So you want the inflammatory process during a workout. So
It's
if
very interesting. Okay,
Yes,
that's,
that's correct.
but you want the ice, I still do it because I'm like, I don't care about my muscle growth. I don't want my joints inflamed.
that's exactly, I do that after long runs basically.
So maybe during training, avoid the ice bath sauna for like 3-4 hours and do it
Yes.
the next day. Or if you're training in the morning, do the contrast therapy at night. The people that are really into it almost want to end on the cold, step outside so your body's shivering.
Right.
So that your body fights it and internally heats itself up. But to your
First time.
answer,
Yeah.
don't leave
Yeah.
cold because
That's not.
if you're not used to it, there
Yeah.
is a risk of catching a fever, getting hypothermia because your mind
Exactly.
is stronger than your body.
Your body
you
gets
will-
shocked.
Don't
all of a
compete and
sudden.
stay in there longer. So it's really good. Do the hot cold.
Oh.
If you're doing it for inflammation and injury, don't be brave. Don't do the 3 degrees. Don't do the 6. Do the 9-10 degrees. It's do it for 5 minutes. Don't do it for 10. It will help. And the
I
hot
mean,
cold
5
works.
minutes is already quite hard. I think you're going for 30 seconds.
Or
yeah, let's try it.
feel comfortable.
Yeah, feel as
Hardest,
per
right? It's,
as per comfortable.
Yeah.
So getting in is the hardest thing. It's,
Yeah,
Yeah.
so that's why you want
After
to
that, you
prep.
feel warm.
Yeah, so
After
you want to
that,
prep
you
your
know,
body
like-
first. You want to warm your body up first, 10 minutes sauna.
yeah,
Then
that's
you,
why.
you go in there.
I see.
You won't feel like a shock to your nervous system.
Yeah, but that's a shock, right? If you warm your body up,
Yeah,
then it's
A little
uh,
bit. Not really.
It's easier.
It's easy, yeah. Yes,
because
for sure.
because you're warmer on the outside, the shock you think
the
would be
texture.
greater,
My hand.
but your body
But
is
you
so
straight away
heated
went
that you
into the
want a bit
ice
of the
bath,
cold.
right?
Yeah.
Versus coming in and
It's
just
shocking.
jumping in.
It's shocking.
Yeah,
Okay, try to give that a try.
Yeah, give it-
A place next to my house, I had bought a subscription before they got a ice bath here, so
Yeah. Which one?
Core Collective.
Oh yeah. They don't have a sauna, but
No, they have infrared
They
sauna
have
as well,
it
I
here.
think.
in Anson?
Mm.
Yeah.
Oh, Anson does. Dempsey does it.
No, I remember seeing you.
Maybe.
Yeah.
But yeah.
Who do you train with there?
I don't train with there, I just go use the
Ice and
bath.
sauna?
As
Do it
long as
here.
interest, I know you
Hard
from
for sure,
somewhere.
yeah.
Oh, you're not drinking here, I don't know.
No,
Yeah,
I'm
do-
from here.
I mean, the heat will help to warm up the muscles,
Okay.
but the cold will definitely help the inflammation.
Absolutely, yes.
Yeah, that is
So it really
true.
depends on what you
Yeah.
want,
Maybe
basically.
Maybe some salt water would be nice to reduce the lactose.
So I do that when I race. I always get a nice hotel with a
Yeah.
bathtub, at least with the idea of soaking in. It never happens with.
And then the other thing is best for your lactic acid. If you have apple cider vinegar, just rub on your muscles.
So
And then
I
take
do
a
lactate
shower
tests.
after.
So I know what, like when I do endurance sports, I know at like what threshold I don't want to go over 4 because then it pulls exponentially. So I know at what point my body will be able to clear at what heart rate, etc. So I usually get a lactate test twice a year.
Nice.
So it's
So we have other tests coming out where you go do your blood work, then do the PT, do blood work halfway, then do the PT. at
so
the
I
end.
do similar with also with a metabolic rate,
Yes.
fat
That's-
analysis. Basically, you probably
VO2 max.
Not my VO2 max, but more. So I do a lot of local. I mean, this doesn't help, and I'm I like to drink, I like to eat, but I also do.
Pre 8 p.m. you're okay.
That's okay. No, but I do a lot of fat adaptation as well. So I go like super low carbs, when I'm in training session and for the endurance sports, it's almost
running over other
oxymoronic, right? But then you start just burning fat. It's a nice way to measure, your metabolic rate for fat burning at different intensities as well. Because the higher you go, you'll start burning more carbohydrates, and you only have
so many
threshold of carbs. So
no, for sure.
I would say that if you have any pain, right, then come in and let me assess. Because sometimes like you have muscle spasm and then you go into an ice bath and actually worsen your pain.
I see.
Yeah, because it tightens up your muscle a bit more and then you'd be like, severe pain. So it really depends. Like you don't have any, you need to get an assessment done. That would be better. Yeah.
I had a question, I think, on everybody's mind. What do you guys charge? I mean, that's always, this is all la-di-da, great. I mean, coming to see you guys, how much does that, what would that kind of cost, starting point? Or?
So,
depends.
First, actually, this is just for us to educate all.
Oh, sure, but I mean, assuming you're
are
interested
not
to have
selling teas for that.
Right.
So you guys can stick to your own trainers, or if you're doing whatever you're doing, just make sure. Take these tips and work on with yourself. But if you're looking to come and see us,
we're probably the most competitive in the market.
Yeah.
And we don't advertise price in spite of, so this is an internal argument I'm like, why do you not advertise given you're the most competitive? Because it shouldn't be price-based, it should be value-based. Exactly. But we are below market. So if you look at the other competing gyms, whatever they're saying or whatever Core is saying, Core, because they're freelancers, maybe similar, but compared to any other established facility, we're lower, which I think is super competitive given that there's more.
So I'm running specific stuff primarily, right? So I've got people who do lab testing and I'm doing strength training there, but just more.
Yeah, it's competitive, but